Welcome to Goal Getter, the AAP Physiotherapy podcast. My name is Jen Panteluk, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. Well, I'm really excited to welcome our guest today, Colleen Kuntz, to come and talk to us all about shoulders. Colleen, welcome.
Thank you.
To start things off, could you tell us a little bit about your background in physiotherapy?
Yeah, so I graduated from the University of Alberta. I've done all my training here in Alberta. So I did my undergrad at U of C in kinesiology and then moved up to Edmonton to do my master's in physical therapy up at the U of A. And then I moved back to Calgary and I started in private practice. I was working in a clinic here in Calgary doing a lot of knees and stuff, working with some surgeons and knees, and I had no idea what to do about the shoulder. And so I always like a challenge, and so I needed to figure it out. So I jumped into the deep end and started working in a co-assessment model with the Workers' Compensation Board of Alberta, basically working with the surgeons to see all of the shoulder patients that had been referred for surgery, and then doing the rehab work with the patients that needed to see a physio. So I did that for a number of years, and then the surgeons asked me to help build a practice on the public side called Access Orthopedics. So we started that about 5.5 years ago, and now we have 6 of the shoulder surgeons in Calgary at our office, and I lead the shoulder team here and sort of oversee a lot of the clinic operations. And as a product of all of that, see a lot of shoulders in my practice. So that's a little bit about how I ended up here. Initially, shoulders were the thing I dreaded seeing on my day sheet, but now that's what my whole day sheet is. So
shoulders are now the area that you focus on your day-to-day. Why is this shoulder such a common area for injuries and surgery?
Well, first of all, it's one of the most mobile joints in the body. It's sort of like a golf ball on a tee. There's not a whole lot of contact between the two joint surfaces in the shoulder. And so it relies a lot more on the muscles to help control the shoulder. And it's just, like I said, there's more movement available at the joint, and there's just such a fine balance that needs to happen between all the structures that support it. So it is sort of the second most common musculoskeletal injury in the body for a number of different reasons. There's a number of different things that can happen in the shoulder, but it's mainly just because there is so much motion available at the shoulder and so many different structures around the shoulder that can be injured.
Are there types of shoulder injuries that often lead people to consider surgery more so over other injuries for the shoulder?
For sure, I would say, as a general statement, issues with relating to the rotator cuff, which is sort of a group of 4 muscles around the shoulder that help provide some stability to the shoulder and also help move the shoulder. That tends to be the most common injury, especially as we age. Instability or the shoulder coming out of its socket is one of those more common injuries in a younger population. And if you're asking the question specifically about what leads people to have surgery, I wouldn't say it's necessarily a specific type of injury. It depends on the patient's presentation, and we're going to answer some more questions about that today. But certainly, rotator cuff injuries and instability would be the most common issues or injuries of the shoulder that would lead people to need treatment, regardless of what that may be.
So if someone has shoulder pain or has sustained an injury in their shoulder, you work in a really interesting clinic. So what should their first step be? Should they go straight to the wait list to see a surgeon, or should they go and see a physiotherapist to have their shoulder assessed?
Yeah, so we're doing a lot of work. I've been part of a team. It was actually tied to Alberta Health Services, and now it's sort of on pause with some of the changes to the structure of the healthcare system here in the province. But we had essentially a shoulder initiative where we've done a lot of work, some work that's been published as well, just on how to access shoulder care in Alberta. Basically a pathway and a guideline for family doctors to help guide them in terms of how to manage patients with shoulder issues. And depending on the nature of the injury, obviously there's situations where acute injuries falls, it's important to get that checked out and may even warrant going to the emergency department. But by and large, you just need to start with a physiotherapist. And most conditions, especially if they've just kind of come on over time, can be managed by a physiotherapist, starting with a basic assessment and getting on some non-operative treatment. And if things aren't improving, then we can start to look at other options, look at imaging and bringing in other treatment plans and potentially even going down the path of looking at surgery. But in many cases, we can manage things with a good course. And I wouldn't say physio, it's active rehab, and physiotherapists can serve as the guide in doing that. But it's that active based exercise program, that education that we can provide patients that is a great place to start.
Well, and you mentioned one of the reasons why shoulders are such a common area for injury is because it's not as stable. There's lots of different muscles around it. So, can you talk a little bit about the importance of prevention when it comes to shoulder injuries and strengthening up those muscles to prevent even having to head down that pathway of looking for care?
So, yeah, in terms of prevention for shoulder injuries and just in general shoulder health, I think it's people are becoming more aware and programs are getting better at including some of these types of exercises. The main thing I tell patients about prevention of shoulder injuries is actually load management. So it can be as simple as just thinking carefully about how you do activities and how you build up and progress into new activities. So we're in a climate where we go from cold to hot sometimes in a day, and and the seasons, we are constantly changing the types of activities that we're doing. So we break out the golf clubs at this time of year, or are just getting out in the yard and starting to clean up, and sometimes we'll go and try and clean the yard in a weekend, and that's a recipe for ending up on a physio table. So really trying to do changes in load gradually and sort of pacing your activity, especially when you're just starting something like in this time of year when we're switching up the seasons. So that would be the biggest thing, I think, is load management. And then incorporating just some general exercises to help keep your rotator cuff strong. We don't do a lot of activities in our day-to-day life, or often even in routine gym programs, that isolate the rotator cuff and isolate the movements of your shoulder blade. And those are really important to include. So just getting a little bit of that program, doing that as a warm-up before you hit the range or go to the gym, just doing a few of those exercises to warm up your muscles can really make a big difference.
Are there certain demographics of individuals that you see more commonly in your clinic who have sustained some sort of shoulder injury?
Yeah, I think there's like a couple of different sort of groups, I would say, that we have. Obviously, we have some acute injuries, and that means like you're out and you fall off your mountain bike or things like that are related to a sport or a traumatic type injury. We see a lot of rotator cuff injuries that just come on over time. You get a bit of a sore shoulder, it's a bit grumbly for a little bit. And then we also have like the instability where people are dislocating their shoulder, whether that be related to a sport injury or just that's their genetic makeup. That's how their shoulder moves. It's a little bit more mobile and more at risk of dislocating. And then the other component that we would see is osteoarthritis of the shoulder, where the joint has degenerated over time. And those would be the big buckets that we tend to see. We sort of think about the shoulder, and this is how I teach it to the physios, and this is what I've learned from the surgeons over time, is we sort of think about shoulder in three sort of buckets. One is there's pain is their predominant symptom. So yes, their shoulder can move whether or not they need help to move it or not. Pain is their main complaint. Then there's the unstable shoulder, which means it's dislocating, and instability is their main problem. And then the other piece is stiffness, which that may be related to the arthritis of the shoulder, or they have something called frozen shoulder. But we sort of think about it in those three main buckets and sort of then have a treatment plan that kind of goes to that. And that's how the guidelines that I talked to, like I mentioned earlier, that we developed here in Alberta are kind of based on, and help try and give family doctors and primary care practitioners a bit of an easier algorithm to follow to try and help outline how to manage shoulder issues.
So I find with a lot of people, they may complain about an ache or a pain and they just ignore it or they shake it off thinking it's, oh, I did something a little bit different. What's your advice when it comes to shoulders? Just because they are such a complex area of the body, what's your advice when someone should go and seek an assessment or seek some additional care around their shoulder?
I think in general, it's easier to manage when it's earlier in the process. So trying to be a bit more proactive and seeing someone to help manage your pain, we tend to be able to be a bit, I wouldn't say more effective, but just quicker in trying to help resolve your symptoms. I think things that become chronic tend to be a little bit more difficult just to get that pain to settle and such. So the earlier the better, I would suggest.
What are some of like the biggest misconceptions that you hear around shoulder surgery and maybe someone's fear of going and getting their shoulder looked at when it's not feeling quite right?
So I would break that question down into two parts essentially. There's a common belief, I think, out there that issues in the shoulder require surgery to fix them. I think imaging is very commonly ordered in the shoulder and often before starting physio treatment, and a lot of shoulder conditions can actually get better with just a course of exercises and perhaps some pain management. And so we jump quickly to imaging when it doesn't necessarily need to be ordered. And oftentimes, well, I would say I'd never seen a normal shoulder ultrasound or a normal shoulder MRI. There's always some sort of findings that are listed on it. And it can become very easy for patients to think that there's something wrong, we need to fix it, and we need to have surgery to fix it. And I think the shoulder is such a robust joint, and there's a backup system of muscles that we can get to work and compensate for issues and get people functional and improve their pain that doesn't necessarily require surgery. So I'd say the biggest misconception is that surgery is needed to fix a tear, and we don't need to do that. We can get those other structures around the shoulder to compensate, and that surgery is not always the right fix. In some cases it is, and I'll be a big proponent of my orthopedic colleagues and the work that they do, but I think it is about selecting the right patient and having done the right treatment to make sure that that's the appropriate treatment plan for that individual. And then the second piece about what are people the most concerned about around surgery. I mean, I'm not going to sugarcoat it. Shoulder surgery is one of the more painful surgeries. It's a long recovery, and my orthopedic colleagues will be the first to admit that it's not an easy process. And so it is about educating the patient to make sure that that's something that they're prepared for. And it can be a very effective treatment plan, but it is just a long recovery. And so it's helpful for patients to know what's the plan and what's the course that they would go through related to their surgery to make sure that they're prepared and can get the best outcome.
So in most cases, would you say that it's recommended some amount of physiotherapy is done on a shoulder before they're even considered for surgery?
I think the shoulder is a very complex joint, so it's hard to answer that question. For all shoulder conditions, I would say in the setting of rotator cuff issues and a lot of just general shoulder pain, like starting with a good course of active based treatment, maybe getting an injection for pain management depending on the situation, or some sort of pain management on board, whether that be through education, injections, et cetera, then that can be helpful. I think there's other conditions where, it's good to have that conversation about what is the right course of treatment. It's hard to say a blanket statement on that one.
So we know that one of the most common shoulder challenges that someone may face has to do with the rotator cuff. So maybe let's dive into that a little bit more, just to understand what that journey may look like if someone is experiencing a rotator cuff issue.
We tend to see sort of two categories of rotator cuff injuries. One would be an acute slip and fall, like you slip on ice prior to the fall, you had full function of your shoulder, no issues at all, and no pain, etc. And you have this big fall, and suddenly you can't lift your arm. And those tend to be what we call like these acute traumatic rotator cuff injuries. And they're the ones that we may sway a little bit more towards surgery on, especially a little bit more quickly, just because it's previously healthy tissue that has now torn away from the bone, and we want to try and get that reattached in a situation where it's got a good surgical outcome. So those are the ones that you can still see a physiotherapist to get going, but they can tell pretty quickly whether or not there's a more significant injury to the rotator cuff. And then the other one, or the more common injury to the rotator cuff, would just be sort of this pain kind of gradually coming on over time. Maybe you tweak it over a weekend doing some sort of activity or things like that, but it's just kind of that grumbly shoulder, a lot of pain at night, and there's just that gradual onset of pain, whereas the other one's like quite distinct. There's a traumatic injury. This second group that I'm talking about tend to do quite well with a course of physio. And in fact, most of the surgeons will want to have seen a patient go through a course of active rehab to see if that can improve their pain, because that often can help them improve their pain and function.
So when it comes to those that have to go down the surgery route and it's more immediate, is there any level of like prehab that they may need to do, or is it try to get them through as fast as they can for surgery?
We generally have a bit of time, like a window to address those individuals, and usually we get some imaging to look at the cuff to see a couple of different factors, like the size of the tear. We also look at the quality of the muscle tissue, just to sort of see what the outcome, like what the best surgical plan is and what the potential prognosis or the outcome of surgery could be, so that we can make an informed decision, or the surgeon can make an informed decision, really. I say we because I work with them so closely in these appointments often. But in terms of like prehab, the most important thing in these acute shoulders is that we keep them moving. So we really advise against putting your shoulder in a sling. We want to keep it moving. You can develop a stiff shoulder in an acute injury, and that can then lead to a stiff shoulder post-operatively. So the biggest key is keeping it moving, and as much as you can, keep the muscles around the shoulder active and rehabbing as much as you can. Oftentimes it's painful, so we just try and do what we can in terms of keeping things moving. But stretching often throughout the day is what I usually am instructing those patients to do, just to keep that shoulder from getting stiff.
Are there instances where some of those candidates maybe recover really well from doing active treatment while they're waiting for surgery, and then maybe the plan changes? Or typically once it's decided that surgery is the best path forward, that's typically where it ends up?
If someone gets better with rehab, which is very possible, like I've been able to rehab patients who have no rotator cuff and basically build up the muscles around the shoulder to compensate for the shoulder, for the tear in the rotator cuff, and they are quite functional and their pain is improved, and we're all too happy to continue to let them go. I mean, it's more about the patient's pain and function, and
Mhm.
that they can do the activities that they want to be able to do. That's the most important part. So yeah, for sure, we have been able to rehab patients and potentially avoid a surgery. And in that other category of degenerative tears, there's a study done here in Alberta at the University of Calgary by Dr. Borman and his team that showed about 75% of patients with chronic rotator cuff tears can get better without surgery. It was a 12-week course of an exercise program and an injection for patients who maybe needed an injection to help enable them to be able to do the exercises as a short-term management strategy. But yeah, 75% of them got better, and they've looked at that data at 2 and 5 years and have shown that a significant portion of patients have remained functional and not requiring surgery. And I know that they are just working on their 10-year data with similar results. So that's a homegrown research here in Alberta that shows that active-based rehab can be really effective in managing rotator cuff tears.
Thinking about the first bucket of individuals who are on that path for surgery, what does the role of physiotherapy play in the post-surgical recovery?
Well, you have a good relationship with your physio after shoulder surgery because you're with them for a little while. So, one of my colleagues, orthopedic colleagues, he says that the rotator cuff heals 10% a month after shoulder surgery.
Oh,
So,
wow.
it's a long process, and this is all rotator cuff injuries in general. It's about 6 weeks in a sling where you're allowed to take it off just to, do some of your exercises, a little bit of hygiene for resting on a pillow, but you're generally in a sling for about 6 weeks. And then we get started on some assisted range of motion exercises where you're not necessarily using the muscles in your arm fully yet to move your arm, but you're doing some range of motion with a stick or things like that, and just starting to strengthen some of the muscles around the shoulder. At 12 weeks approximately after surgery, we start to do some strengthening of the muscles that you actually had repaired. And then it's like a 6-month process of just building up those muscles and gradually increasing the load that you're doing to get you back to your activities. But it's often 10 to 12 months for a full recovery from a rotator cuff repair. And I even think your muscles are rebuilding beyond that, that you're getting your strength back. For some of the bigger rotator cuff tears, we do things like grafting the shoulder and such like that to try and help repair tissue that they're maybe not able to get all the way back down to the bone, or to help add to the repair. And so those are sometimes even longer timelines for those surgeries. So like I said, you get to know your physiotherapist very well. And we sort of serve as a guide. Like, it's not it's the patients that really do the work to recover from their surgery. They're doing the exercises on a daily basis. What I do in my, half an hour to 45-minute session with them is not fixing their shoulder by any means, but I'm giving them the tools to be able to rehab their shoulder and get back to the things that they want to do, and just serve as a guide as to when to do what, essentially.
What are some of the common mistakes people might make during their recovery that can really slow down their progress?
The biggest thing is going too quickly. I did say that rotator cuff surgery can be painful, and it can be for a number of people. There's a reason we don't see people in the first 2 weeks for their follow-up appointment. But sometimes it can actually help with their pain, and they start to feel better quite quickly. And so around that 3-month mark, they're getting into some strengthening exercises, and sometimes people jump too quickly, and then it doesn't necessarily damage the repair, but it makes them sore. And so we just have to find there's that really fine balance of where we want to load the shoulder. We don't want to just protect it and not move it, because that's also not helpful and can lead to stiffness and more pain. But it's finding that balance of load, of progressively increasing that load. So yeah, I'd say the main thing is just too quickly.
With all things, people are very impatient. They just want it like yesterday.
And that's why I say rotator cuff surgery, and often at most shoulder surgeries, it's a complex joint, and there's lots of things that are healing around the shoulder after surgery, and so it does take time to recover. So that's the one thing I would say patients say, I didn't expect it to take this long. And I was like, well, we could have told you so. And they're like, I know, but I still didn't expect it to be this long.
So when it comes to rehab, is it structured differently for someone who has a degenerative rotator cuff injury as opposed to someone who, had that rapid tear from a sport or other related activity?
I mean, I talked about some timelines in my last question there about just when we start range of motion, when we get out of the sling, those sorts of things. But in my practice, I focus more on the patient and how they're recovering, and more about milestones than timelines. So I'm looking to see how is their pain doing? How is their range of motion progressing? How is their strength progressing? How are they doing during the motions? Like, is their shoulder blade moving well? So it's more looking at that to try and structure how things are progressed. So I'd say it's less based on, is it an acute tear? Is it a degenerative tear? It's more about individualized to each patient, how to progress them, and making sure that those milestones are being hit. We actually redesigned our shoulder post-op protocols for the surgeons that are working with our group. And instead of there's some rough guidelines around timing, but it's more goal-based, and we want to see certain things at the end of each of our phases before we move patients into the next phase. So for someone who's stiff, which could very commonly happen in either scenario that we're talking about here, I'm not going to progress them into their strengthening because I want them to get their range of motion first. So it's more based on the patient presentation than it is necessarily the type of tear. But I'll certainly look at their OR report too and get a sense of how robust the repair was and what had to be done in the surgery to help guide my rehab program as well.
That makes sense. And I assume, like back to the point when you're doing that really thorough assessment up front and asking about their history, that probably lends a little bit to what the like rehab structure looks like. Someone who was really like generally healthy before versus someone who's kind of had that ongoing pain in their shoulder, or I imagine
Yeah,
history plays in a lot to that.
yeah, the patient, I treat patients, not shoulders.
Yeah.
So we're looking at all of the factors that can impact healing. So there's different conditions, like medical conditions that might slow or impair healing or lead to perhaps an increased risk of infection. So we're always watching for that. One of the things that we discuss commonly in shoulder surgery is the impact of nicotine. So nicotine reduces the blood flow right down at the cellular level where there's the nutrients and are being exchanged in the tissues, and a single cigarette can impede that circulation at that tissue level for about 8 hours. And so we see a significant increase in complication rate or failure of surgery with individuals who are smoking. So that's oftentimes a conversation that we'll just have to help support the patient in trying to quit smoking prior to surgery to help improve the outcome of their surgery and to help ensure that rotator cuff heals down to the bone, because that's the biggest thing. The surgery puts the tendon there down to the bone, but it's your body's job to heal it back down to the bone. And so that's what we're trying to do post-operatively, is help support all of that. And so loading the tissue progressively helps to build that repair, and also things like not smoking, eating healthy, keeping active as best as you can, those sorts of things after surgery can help with all of that.
Do you ever have someone who comes in, after the assessment, it's deemed surgery is likely their best path forward, but they don't want to go down that road. Maybe they've heard stories from someone else who's had shoulder surgery, or are worried about what the recovery looks like afterwards. Do you see that often in your practice?
Yeah, we do. I think we see a lot of shoulders in our triage program. And as I've discussed, like shoulder surgery is not an easy go. And for whatever personal reasons, whether or not they can't take that time off work to do the rehab, or like you said, they're nervous about going through, then of course, then I think we can do a lot from a rehab perspective to try and help improve people's pain and function, and can be quite effective in doing that. So oftentimes that's the path that we'll take in that situation. So yeah, there certainly are situations where that's the case.
If someone's had a history of shoulder issues, maybe they've had shoulder surgery, are they more prone or at risk for an additional injury or re-injury down the road?
It's dependent a bit on the patient's presentation, but oftentimes at the end of the journey of a post-op rehab, I'll talk to the patient and I'll say, like, you're not really at more risk than injuring the other shoulder, and these strategies that I'm teaching you in terms of pacing and gradually building load. And so, like, if you're sick for a couple of weeks and you're going back to the gym, start back down low. Like, those are strategies that I'm teaching people, not because they had surgery to their shoulder, but because this is just general principles that can help prevent injury on both of their shoulders and help keep their shoulders healthy. I think there's nuances. Like I said, there's such varied injuries to the shoulder, so it's hard to say a blanket statement like that. But in general, I would say that the things that I'm teaching patients is to help prevent injury in both shoulders.
And likely that patient education isn't just for people who have shoulder
No.
issues, but general population should be really mindful of their shoulder health so that they have strong shoulders.
Yeah, I think the problem is a lot of us have sedentary jobs. And I say that because now I sit in a management position too, and I'm at a desk more than I'm treating. But we have oftentimes sedentary jobs, and then we go and we do activities in the evenings, and we're trying to like pack in our workout, or we're trying to pack in our activities on the weekend, or fix the house, or do the yard work and things like that. So it's just that quick changes in load that can lead to injuries in the shoulder. And so trying to build in that general strengthening program to keep your body healthy and ready to tolerate those activities is what's key.
So you've chatted a little bit about, the importance of warming up your rotator cuffs and making sure that your shoulders are strong. Are there any other exercises or habits that can help to prevent shoulder injuries or to keep individuals' shoulder health at a fantastic level?
I think movement is key, like just getting up and moving throughout the day is important. I think there's lots of research to show that even if you sit the same amount in a day, if you have more breaks and get up in between, that's generally more healthy for you. So that's a first key. I think even just setting your shoulder blades back, drawing your shoulder blades together, we get really folded forward in front of our devices and activities throughout the day. And so just that little up and back of squeezing your shoulder blades together just for 5 seconds. I mean, I'm not a hypocrite and I've slouched throughout this podcast, but just doing that little bits, but often throughout the day, and especially when you're going to do an activity, lifting, those sorts of things, just setting your shoulder blades together. I see patients who sometimes have had physio and with other providers or other types of treatment and things like that. And that's often one of the first things I do is go back to the basics and just helping get the shoulder blade control better. And then we seem to make more progress. So that's oftentimes the first place that I start with patients is just getting that positioning.
So on that point of posture, how important is posture for good shoulder health?
Posture. That word. Everybody's like, oh, my posture. I think it's, again, about movement, and it's less about being in that position all day, and it's more just about movement. And it is helpful. You are at a bit of a mechanical advantage around your shoulders when you are having your shoulder blades set together. Everything can work a little bit better together to help support your shoulders. So I think for sure when you're going to lift a load or things like that, setting your shoulder blades can be helpful. But in general, it's just about movement and progressive load. That's more important than just having the perfect posture all day.
Do you have any advice for active individuals who are maybe looking to protect their shoulders when they're out doing their activities that are maybe at a higher risk for shoulder injuries?
I think a general strengthening, like incorporating a general strengthening program into your routine. So it doesn't mean that you have to do a shoulder strengthening program when you're out mountain biking for the weekend, but having a regular workout routine in addition to that, like having some variety of load in your activity can be helpful, just so that you are doing some time focusing on strength of those shoulder muscles. So building in that rotator cuff strengthening program. There's tips and tricks that I teach patients even with like their shoulder press program and just setting their shoulder blades while they're doing their bicep curls, but just in general doing some weight training strengthening program in conjunction to their activity so that they are keeping those muscles strong is the biggest thing. Doing the same load every time. Like I remember doing a running course and it talked about running injuries and someone running the same route every time and they just go flat out. So it's the same load always being applied. It's really about a bit of variety of load and gradually increasing that load.
Thinking about the rotator cuff, and when it comes to strengthening, are there certain muscles that you should be focusing more on than others?
So there's no easy way out on this one. You got to strengthen everything. I remember reading something early on when I was getting into shoulders that really sort of clicked with me, and it's some research from baseball, but it's like 50%, like when you're throwing a baseball, about only 20 to 30% of it comes from the shoulder. 20 to 30% comes from, or 15 to 20% comes from just hand, wrist, and elbow, and then 50% is core, lower body, all those sorts of things. So really having a well-rounded program is helpful. So you want to work on strengthening your core, your glutes, all of that. But when it comes specifically to the shoulder, I do a lot of strengthening of the muscles around the shoulder blade. So I like to do lots of rowing type exercises. You can see I'm a physio here as I'm like moving my hands and moving my body, showing you these exercises. I can't talk about them without doing them. So lots of rowing type exercises, strengthening the muscles in the back of your shoulder. And then we would work on the rotator cuff muscles, doing something called external rotation exercises, internal rotation exercises. I love pressing exercises. I tend to work a lot on what we call shorter lever exercises, where you're not lifting a weight with a straight arm. Those are hard on the shoulder. So I tend to do a little bit more shorter lever exercises for patients. Not that I don't do long load lever exercises, but really you need to be at an advanced rehab stage to incorporate that, but just working on those shorter lever exercises and shoulder blade muscles.
So for someone who maybe doesn't have access to a gym and is looking to, do some preventative strengthening at home, do you have any recommendations for exercises that they could do with what they have available around their house, or some inexpensive items they could purchase to help incorporate into their daily routine?
For sure. Like most of my shoulder exercises, you don't need to be in a gym. So it's simple as using some exercises, bands, to doing some rowing exercises, cuff exercises, light weights. You don't even need free weights. I use water bottles, soup cans, spaghetti sauce jars, whatever you have at home that has a little bit of weight. And there's a number of different exercises that you can do with that. Like I said, focusing a lot on rows, a lot on how you position your shoulder blade with your exercises, a lot of rotator cuff strengthening. That would be my initial go-to.
Is hypermobility ever a concern when dealing with rotator cuff issues?
So hypermobility is its own entity, really, and that would oftentimes fall into that bit of instability bucket where what we see in instability is like 95% of the time is a traumatic injury where someone has a fall or something happens that causes their shoulder to come out of its socket. But the other 5% is sort of this hypermobility domain, or sometimes the shoulder goes out the back instead of the front. But hypermobility is just where your genetics, it means your makeup means that you have more motion of the ligaments and the structures around the shoulder, and you need to rely more on the muscles of the shoulder. In some cases of people who have hypermobility, as they age and their tendons are get a little bit more degenerative over time and things like that, then you can get issues with the rotator cuff. Again, it's a bit of that combination, and it's about getting the muscles to support the shoulder. So we have to work through that. So it doesn't really change necessarily my approach in that situation, but we are just working on getting the muscles to help control the shoulder better.
So for someone with pain or injury in their shoulder who chooses physiotherapy as the first step, what might they expect when they go for their first appointment or subsequent appointments?
The first assessment is just about doing an assessment, taking a history. Like, I really get a sense of what's going on from the questions that I'm able to ask the patient. The next step would be to add in some physical exam tests, which means we'll get patients to move their shoulder. We'll do some tests to check how strong their muscles are and just test different structures around the shoulder. But that's often in my scenario just confirming or maybe changing what I was thinking based on the questions that I asked the patient. And then we'll get right into some treatment, and that can involve a variety of things, but really the mainstay of treatment and what the evidence really supports is doing an active-based exercise program. And similarly to post-op rehab, the physio is just a guide in terms of helping sort of say when to progress to different types of load and how quickly to progress. So we would start with range of motion exercises. If that was an issue, if the patient was having some stiffness or couldn't lift their arm, we would start with some range of motion exercises, and would also include, as pain allowed, some strengthening exercises of the different muscles around the shoulder, teaching patients how to move their shoulder blade. I'm just sitting here drawing my shoulder blades together, demonstrating how we would teach them to sort of set their shoulder blades with activities and things like that. And then also a lot of just education on different strategies to help manage their pain, whether that be sleeping positions, like having patients sort of position pillows under their arms and behind their shoulder can help patients sleep a bit better at night, or using ice or heat to help manage their pain, and just encouraging patients to do a little bit of movement throughout the day just to try and keep things moving and keep the blood flow to the area can also help to settle pain. And then subsequent sessions would just be to progress that program, increase the amount of resistance, increase the range that they're doing, those sorts of things. It shouldn't be super often. I generally only see patients every week or every couple of weeks even, and even spreading it out as the load increases, as they're doing more strengthening exercises and stuff. It may even be 3 to 4 weeks in between sessions, just to give patients that opportunity to do their exercises in between. And then they basically come back when they're ready for the next progression, is what I say. I may do some hands-on work as well, doing some massage or even in some cases some dry needling to help manage their symptoms. But I'm always educating the patient that that's really for the short term. The long-term goal is to get them moving, get them stronger, and that the exercises are really what's going to provide that longer term benefit. There are other things that physiotherapists do out there, like TENS or different types of electrical modalities, we call them. They may help in the short term for the patient's pain, but in general, we like to see a focus on more that active exercise program.
You'd mentioned earlier that a big role a physiotherapist plays is in guiding a patient along and helping them to know when to progress, how to progress, maybe some different exercises to incorporate into it. When someone comes back, do you know when they've done their homework or not?
Yeah, I think I see patients as like part of the team. Like it's not like the patient's in the center and everybody's around them helping to support them. Like the patient is the most important person on the team. And, I can lead the horse to water, but the horse has to drink, right? So, I think I'm always reevaluating, do we need to change the treatment plan if they're not making a progression? And if I'm getting the sense that, the exercises aren't happening, well, I try and explore, why is that happening? Is it because the exercises are painful and they don't want to do them? Well, then we need to reevaluate the exercises. Or do we need to make the exercises fit into their day? I tell patients my exercises take as long as brushing your teeth. So if you brush your teeth a couple times a day, like the dentist tells you, then you should have time for my exercises too, because they should be quite quick. I mean, if your goals are to be doing heavier activities, then yes, it may take more time and you may need to spend more time doing them. But at least at the outset, the exercises are fairly simple and you just break them into your day. It could be easy as sitting at your office chair and doing a quick stretch, or tying a band on your door handle to your bathroom and doing a couple repetitions before you go to bed. So if I get the sense that maybe the exercises haven't happened, it's about teaching the importance of the exercises again, and then finding a way that we can make it work in someone's day to make it more feasible.
I think that's what I love most about all of my experiences with physiotherapy throughout my life is the education piece and the focus on education. And just, I find that so important to understand, okay, why am I doing this and what's the result going to be, versus just being quote unquote prescribed something and not maybe understanding how it's going to benefit or what goal it's going to help me work towards. So I think that's just such an important piece of physiotherapy and like those appointments, and actually spending time with the patient to understand what's happening, and to your point, like how do you fit it in. I could just envision someone in their kitchen cooking dinner and having 2 soup cans, right? You just said, find the everyday objects around your house.
I think everybody knows I like tell patients, just while you're sitting at a red light, like draw your shoulder blades together. I'm probably in so many people's mind as they're sitting waiting at a red light, just like, oh, Colleen's telling me to draw my shoulder blades together. But like what you said too is something that's important, is it's tying it back to what is important to the patient. So usually one of my questions I ask in the initial assessment is like, what's important to you? Like, what do you want to be able to get back to? And whether that's unloading the dishwasher, or you want to be doing a high level sport and getting back to something on the weekend. Like, it's meeting the patient where they're at and trying to tie those exercises back to that functional goal and explaining to them what this will enable them to do, hopefully down the road. And then it's reevaluating. It's like checking in at every appointment, like, are we on the right track? And this isn't part of the question, but I'll jump into it, is that if things aren't going the right direction, like physios can also be that person to help say, like, I think we need to, maybe now is the time to get the imaging, or maybe we need to look at talking to your physician about getting an injection to help you be able to do these exercises, or help you get some sleep and do the exercises so we can move you along. So we can also be that sort of help in a care navigation way, where we can help sort of guide them through the path of what's the next step.
And helping them to identify what that journey may look like if there's
Yeah.
alternative measures that need to be taken. So you've given us a wealth of information around different aspects of shoulders and shoulder health. What's one piece of advice you wish everyone knew when it came to shoulders?
So I think one of the most important things that I would like to leave everybody with is just the importance of keeping your shoulders strong and your core strong. Really, like I said, is just keeping active and having a bit of a general exercise program is quite helpful in general to keep your body healthy, not just your shoulders. So a couple times a week, just doing some resistance training, incorporating some cuff strengthening, incorporating some core strengthening for my hip colleagues out there, some glute strengthening, just having a bit of a program that you do in conjunction with the daily activities can be helpful in ensuring that you keep your shoulders healthy and keep being able to do the activities that you love to do.
Thank you so much for joining us today, Colleen. I think there was some great tidbits and information that everyone can walk away with an enhanced knowledge of what they need to do to keep their shoulders strong. And I know every time I stop at a red light, I'm going to have you in the back of my mind and I'll be like squeezing my shoulder blades together. So thank you very much.
Thank you for having me.
Thanks so much for joining us today. We had a great conversation with Colleen all around shoulder health. If you're interested in learning more about physiotherapy or to find a physiotherapist near you, visit albertaphysio.com. See you next time.